Welcome to my podcast. Today I'm going to talk about another case. It's basically about hip and anything around the hip area. So basically, after you introduce yourself and ask the patient name and date of birth, you will ask the patient, how can I help you today? So the patient will tell you, oh, doctor, I'm having hip pain. I'm having issue in this area. I can't walk properly. It's keeping me awake all night. And it's affecting me in my daily activity. So you will ask the patient, can you tell me more? And then you will ask some specific questions, like, for instance, does this pain comes and go? Any trigger for the pain? Anything ease it? If there is any history of associated trauma, like for instance an elderly, a fall, trip or slip, and if they manage to walk or raise from the fall, and if they experience any pain all of a sudden due to the fall. And then you will ask if there is any, for instance, history of pain before, any stiffness, if the walking make it worse, or if the rest improve it. You will ask also certain specific questions to differentiate basically between rheumatoid arthritis and osteoarthritis. So if the pain and the stiffness worst after not moving, for instance, that would click with the rheumatoid, and vice versa with the osteoarthritis, which get worsened with walking, and basically there's stiffness associated with that. If there is any fever, you will ask the patient if there is any swelling, if there is any shivering. If the patient feeling very hot, this could point out to infection. So it could be something called septic arthritis. And if the patient had any history of twist, or patient may be doing certain exercise or doing too much strain in a repetitive way and an intense way, so it could relate to strain and sprain in the joint and the area around. And as I mentioned, if the patient had history of a fall, basically an elderly, so this could be basically hip fracture, where the patient won't be able to walk and will experience a lot of pain. And after you ask all of those questions, you have to ask about the patient idea and thoughts, if there is anything that the patient might link the pain to. And then you will ask about the past medical history, just to guide you through what's going on, if the patient has any underlying medical condition that worth attention, say for instance like diabetes, any other chronic illness whereby the patient may be taking a medication on the long run. So this will take you to the medication history and history of allergy, and then family history, if there is anything that might be running in the family, just to give you ideas what might be going on. And then you will ask the patient about their smoking and drinking habit, and their lifestyle, like for instance diet, any certain activity, any physical activity like walking, jogging, exercise, this sort of thing. And then you will ask the patient, if you are happy, I would love to examine you, just to have an idea what's going on after taking the observation basically. You will ask a chaperone to attend with you, and then you will explain to the patient what might be the reason for this pain. So in that condition, you will have some hints about some differential from the history you were taking from the patient, and then agree with the patient about the management plan, and never to forget about the safety netting. So you just tell the patient, avoid as much strain or bearing weight on the area to relieve the pain. You will prescribe a strong painkiller, and you will ask the patient to try to lose weight if they are overweight or obese, and try to keep the joint moving by gentle stretching exercise, or trying to walk in the area around, just to keep the joint moving, to avoid any stiffness. And of course, you will tell them about the frozen piece, whereby it can be wrapped in a towel and should be repeated every 3 hours. You will ask the patient avoid, because basically this is the pelvis, so if the patient wants to sit, it's always mandatory to avoid any low chair. So it's better to be in the level of the flexion of the knee. So because basically if the patient sits in a very low one, this will exert a lot of pressure in the hip area and will cause too much pain, and this will bring us later on to help replacement and the general advice that you need to give to the patient after the operation. And of course, as I mentioned, safety net the patient. So you will say if the pain did not improve, if you feel that there should be something that doesn't seem right, or if the pain is affecting and hindering your physical activity or keeping you awake, you're not able to sleep, all of that. And if the patient developed, for instance, fever, shivering, feeling unwell, or there swelling, all of that mandate going to the A&E immediately, or dial 111, or go to the surgery again. And of course, you will state about referral to the physiotherapy, and if the patient is working, to the occupational therapist. And in such a situation, you refer to the specialist, whereby they will, of course, treat it accordingly, or will inject steroid intraarticular to help with the inflammation. And of course, in certain situations when the damage is too much, this will require, basically hip replacement, which will be arranged accordingly, and according to the type will be discussed with the patient. I hope by that I covered the main points about the hip pain and how to approach it and manage it accordingly. Thank you.